Hello, my name is Stephen Bowerman. I'm the President and Chief Executive Officer of Midland Health. I want to welcome you to a virtual tour of our facility master plan that kicked off in February 2024. I want to share with you some of the goals that are part of this strategic plan, the timing, the cost, and the funding before our docents go through the project with you in a little more detail. The project is broken up into three main phases. Phase 1 completed earlier this fall in 2024. The main component of Phase 1 was a new roof and facade at the F. Marie Hall Outpatient Center. We also moved some clinical departments and support departments out of the old hospital to prepare for its demolition. Phase 2 is the major component of the project. A few of the key components of Phase 2 include a new professional office building, 4 stories, 100,000 square feet. If you've been down Illinois Street lately, you've probably seen the steel hanging. We are also adding 2 additional operating rooms to the 3rd floor. This will provide about a 20% expansion of our 3rd floor operating room. There's 10 operating rooms today. We'll have 12 when that is complete. We're also creating a new path for our endoscopy department with renovations to the waiting room and the clinical rooms for our patients and visitors, give them much easier access and a state-of-the-art facility there. Also, as a part of Phase 2, we'll have a covered walkway that will connect the professional office building to the main hospital building with a 10,000 square foot garden that'll provide a respite space for patients, visitors, staff, physicians, anybody that needs it that's in the hospital setting. One other key component of Phase 2 is our new outpatient pharmacy. The hospital has an outpatient pharmacy today that serves only employees of the hospital and those that qualify for indigent care services at the hospital. By relocating our outpatient pharmacy to the main campus, we'll be able to start a meds-to-beds program that Tim will talk about that ensures patients leave the hospital with their prescriptions. Phase 3 will start in January of 2026. 2 major components of that project include a renovation of the Abel Hangar Pavilion that is on the corner of Andrews Highway and Illinois Street, just south of the hospital. We'll be relocating our Infusion Services Department from the main hospital over to the 1st floor of the Abel Hangar Pavilion. On the 2nd floor, we'll create a state-of-the-art simulation center for staff and physicians for training purposes. This simulation center has already received accreditation and is one of 20 accredited simulation centers in the state, and the only standalone simulation center not associated with a academic medical institution, the military, or a children's hospital. We think this will be a game changer for recruiting the future workforce at Midland Health. The other key component to Phase 3 is the demolition of our South Tower, the original 1950s building that was the main part of the hospital for many, many years. This building is really beyond disrepair at this point and is a money pit, and we need to tear it down. The benefit of that is to create additional parking for the existing space that we have in the hospital. Parking is challenging today, but more importantly, it really lays the foundation for additional towers in the future as our hospital needs to grow to support the community in the region. The total cost of all 3 phases of this project is approximately $157 million. No small feat for a hospital our size to accomplish. The hospital has a strong balance sheet and issued a bond early in 2024 that did not impact taxes. It is funded by revenues from the hospital. The total component the hospital is putting into the project is approximately $112 million, and the hospital and Midland Memorial Foundation is partnered, seeking $45 million in support from philanthropic partners in the community. As of today, we've achieved a little over half of that funding from the foundations. In closing, I want to thank you for taking the virtual tour today and hearing from our docents on the specific components of the project. Hopefully you're excited about what's to come at Midland Health and the services that we'll be able to provide to our community and across the region. We would welcome your support. In this presentation, there will be a link to the Midland Memorial Foundation with material that you'll hear today, as well as some written material that you might be able to print out. If you want to advocate about the project with your friends and family, we'd appreciate that. And of course, there is a link to donate to the Midland Memorial Foundation in support of this project. And we appreciate your support as we continue to lead healthcare for Greater Midland and achieve our vision to make Midland the healthiest community in Texas.
Hello, my name is Tim Warkula, Director of Pharmacy for Midland Health, and I'm excited to tell you about our new plans for a new outpatient retail pharmacy that will be located inside Midland Memorial Hospital. This new location, opening the summer of 2025, will allow us to expand our pharmacy services and better provide for our community. We currently have an outpatient retail pharmacy located south of the hospital across Illinois Street, inside the Abel Hangar building. This pharmacy provides prescriptions to our current employees and a few eligible financial assistance patients. In order for us to expand our services, we saw the need to move this pharmacy to a more central location within the hospital. The first new service on which we will focus once we move will be a meds-to-beds program. This is a service that will provide prescription delivery to a patient's room before they are discharged, allowing the patient the convenience of going directly home from the hospital instead of stopping off at a pharmacy to get their medication. Our new pharmacy will have innovative technology, such as a medication dispensing robot, an automated will call system, and a remote pickup locker, which will allow customers to pick up prescriptions after the pharmacy is closed. It is our hope, by moving the outpatient pharmacy to a more central location, integrating time-saving and convenience technology, all combined with our Meds-to-Beds program, that Midland Health will be able to elevate retail pharmacy services and truly be a shining light for our community.
Hello, my name is Abraham Behill. I'm the Vice President of Facility Services for Midland Memorial Hospital. And I've been with Midland since 2011 and been proud to actually lead this project since 2018. Midland has always been a giving community. In 1948, Midland broke ground on this very hospital, and through the generosity of the community and others, opened their doors for the first time in 1950. For the last 74 years, this facility has served us well, but it's no longer able to meet the demands of healthcare today. In 2012, we built the Scarborough Patient Tower and transitioned all inpatient services to that facility. However, several departments still remain. We surveyed these departments and we determined they didn't need to be inside the hospital. So it only made sense to build an office building adjacent to the hospital, as the cost of construction for an office building is substantially lower than that of building new hospital real estate. The end result was a 4-story professional office building, or POB for short. A few of the departments that will be in the new POB are medical records. Medical records currently is in our old facility in the basement and very difficult to access for our public. Midland Community Healthcare Services, a partner of ours, is also a community nonprofit that provides women's healthcare services in our old facility. They will now be located on the 3rd floor of the professional office building, providing better access for those patients in need of those services. Lastly, we've also accounted for future growth within the POB by providing shelf space for clinics, physicians' offices, or other healthcare services. Also, you will see within this rendering that this building will be connected to the hospital with a long covered walkway with the garden space in between. Now, the garden space not only provides a break from the hospital setting, but it also provides a great outdoor gathering place for small hospital events or even community events. This is a rendering of the future conference space that will be on the 4th floor of the professional office building. Midland Memorial prides itself on leading regional events such as workplace violence and disaster preparedness, and this space will allow us to continue those efforts directly on our campus. You know, when we built the Scarborough Patient Tower, we planned ahead by building an additional floor, and we shelved it for the future expansion. We took advantage of that floor during COVID and built out 48 additional patient rooms. So by tearing down our aging facility, we aren't just building new real estate for hospital departments, but we'll be laying down the foundation to expand with our community for tomorrow.
Hello, my name is Ben Burton. I'm the Operations Manager of the Facility Services Department. I've worked here for 21 years and I'm excited to see this next phase in Midland Health's vision. One aspect of that is the new South Tower entrance, which will clear our landlock, lay the foundation for the future, and open up many possibilities for us to better serve our community in the years ahead. A major part of this is the new endoscopy waiting room. Currently, you must navigate a multi-floor maze to find this location. This project will shorten that journey and provide a better experience for patients and families. Additionally, we're going to build out 2 new operating rooms. It is interesting to note that 40% of our surgery cases come from outside of Midland County. This will allow us to expand our bandwidth by an additional 1,800 cases per year. This project is not just about buildings and construction. It's about creating a future where our community has greater access to exceptional care. Together, we are shaping a space that will enhance the experience of every patient, visitor, and employee that walk through our doors.
My name is Tim Simachek, and I'm the Director of Perioperative Services. I've been in this role for about 3.5 years, and about 2 years ago, I assumed leadership over our Infusion Center. Now, to tell you a little bit about what our Infusion Center does, we do outpatient IV or injection therapy for a variety of conditions. Some of these patients come to see us every day for an antibiotic infusion for maybe a newly acquired infection. Some of these patients come to see us once a month, once every 3 months, maybe even once a year. And some of these patients have been with us for several years. Right now, our infusion center is located on the 6th floor. And you may know that on the 6th floor, we also have our same-day surgery. That's where all our outpatient surgery patients go to. And our surgery volume has grown exponentially. I mean, we're a lot busier than we were several years ago. With the addition of 2 new operating rooms, we're going to need those beds on the 6th floor for surgery patients. So what we propose to do is move the infusion center across the street, across Illinois Street, to the Abel Hangar building. Right now, our infusion center is not really conducive to the best patient experience, even though we do pride ourselves in giving exceptional care. It's a little inconvenient for our patients because they either because they park out in the parking garage, or they use valet parking, or park out in the parking lot and then make this long trek up to the 6th floor, which they could never find that by themselves. And some of these patients may not be the most mobile patients in our facility. Now they're going to be able to pull up right in front of the infusion center, walk right into the front door into the reception area, and from the reception area they go back to their treatment room, which is going to be right behind the reception area. Now we have 2 types of treatment rooms. We have private rooms. We'll have 4 of those. And these are going to be for the patients that come in for infusion where they're going to have to stay for a while. For instance, a blood infusion, that patient may be with us for 4 or 6 hours. So they will have a private room with a private bathroom, TV, and a full-size bed. And also in the individual rooms, we'll have some state-of-the-art equipment. One thing that's going to be really good for our patients and our staff is we have automatic hydraulic patient lifts that are in the ceiling. And some of these patients come to us from long-term care facilities. They're not mobile at all. So to move these patients from a gurney onto the bed, we do have these patient lifts that will lift the patient up, strap the patient in, and then it moves them over to the bed. What this does is it will keep our patients safe and our staff safe. The inpatients that come to see us for maybe just an injection or a quick antibiotic therapy, and they're only going to be with us half an hour to an hour, we'll have communal rooms where we have 4 chairs there, and they can just walk in, have a seat, get their infusion, and be on their way. It'll be a lot quicker and a lot more convenient to them. One of the things that I'm really looking forward to are these patients that have been with us for a long time. They're used to the setup that we currently have. I'm really excited about seeing their reaction whenever they walk into this for the first time and be able to experience the convenience, and I think they're going to be absolutely delighted.
My name is Derek Sanchez, and I am one of 3 simulation program coordinators here at Midland Memorial Hospital. As we all know, healthcare is a fast-paced and ever-evolving field. To provide the best care for our patients, we must equip our students with not only our knowledge, but the hands-on skills and critical thinking skills necessary to meet real-world challenges. This is where simulation comes in. Simulation creates a safe, controlled environment where students, nurses, surgical interns, residents, and fellows can learn, make mistakes, and refine their techniques without compromising patient safety. It allows us to replicate complex scenarios from routine procedures to rare medical emergencies, giving learners an invaluable experience before they even step a foot into the clinical setting. But we don't want to just train competent healthcare professionals. We want to be the premier healthcare education destination. Our vision for our Simulation Innovation Training for Healthcare Center is that it becomes the gold standard in training, and for us to be leading simulation in West Texas, a place where healthcare interns, residents, fellows, surgical techs, respiratory therapists, and surgeons come to gain cutting-edge experience, practice interprofessional collaboration, and hone the skills that will define them in their careers. With your support, we can offer advanced training that not only meets today's demands, but anticipates tomorrow's needs in healthcare delivery. Our simulation center will have 12 patient care rooms that will be almost identical to our hospital rooms. They will have the same equipment as well, including the same IV pumps. We will have 2 critical care rooms, 2 ER traumas, 1 OR, 1 labor and delivery, 1 NICU room with 4 pods, and 1 room specifically used for VR training. We will be utilizing these rooms to perform critical thinking, high-stakes simulations where clinicians must go through their unit-specific simulation before taking care of human patients. By investing in the Simulation Center, you're investing in the future of healthcare, ensuring that we're producing skilled, confident, and compassionate professionals who will provide the best care possible. Together, we can create an educational experience that fosters innovation, excellence, and above all, one that makes Midland the healthiest community in Texas.
Hi, I'm Nancy Woodman, Executive Director of Midland Memorial Foundation. Thank you for taking the time to learn about this important project that will have a significant impact on healthcare in our community. Support from donors like you is vital in completing the necessary and innovative updates to our community hospital that you've learned about in this video. To make a donation and leave a lasting legacy on healthcare in the Permian Basin, please visit our website or contact Midland Memorial Foundation.